All right, so we will get rolling. Lots of good news today, as long as you live outside of Texas and Mississippi, probably. So things are going extraordinarily well. The numbers are pretty much going down across the board as the viral factors are going down as far as new cases, deaths, hospitalizations. Vaccine is on the rise. So everyone's probably aware now, J&J has now been released. It's been shipped out. Yesterday, the first doses started getting into arms, so that's excellent. At the same time, you probably also heard that in a somewhat surprising turn of events, Merck and Johnson & Johnson decided to make best friends, and Merck is now taking 2 of their vaccine production facilities to help make the Johnson & Johnson vaccine more available. So that's helpful. Merck did have a vaccine that was in the game until December, January, and kind of flailed as far as meeting the standards that the other vaccines had already shown that they were living up to. So they pulled their trial. They had 2 factories that were geared up and ready to produce, and even though they are direct competitors with J&J, especially in the vaccine game, they have decided to work together. It's a little unclear as to how much the Defense Production Act may have had a role in that. So I guess Biden announced it, but I guess it was within the powers to use all of the facilities within the US to produce. And so there may have been some behind the scenes compelling, but they made it sound like a bunch of warm, friendly relationships. And as long as more vaccine comes, that's all that matters. So now there were 4 million doses that were ready to ship from J&J on date of delivery. By the end of the month, there'll be another 20 million that will go out. Supposedly by June, J&J will have, on their own accord, based on their own production capacity, have shipped 100 million doses. That is now on top of the incremental 100 million doses that both Pfizer and Moderna had committed. So because of that, you probably also heard the news that the Biden administration released yesterday that by the end of May, we should have enough vaccine in the US to vaccinate every person over the age of 18, and probably enough Pfizer to get the 16 to 18-year-olds. So that would be excellent. Obviously, the ability to administer will be the big issue. So we're still trying to kind of get a sense of how much it would take to escalate our vaccination capacity. We already exceeded the 1.5 million doses administered per day threshold that had been set. We then crossed 2 million doses, and I think we were very close to 2.5 million doses administered as of Monday, if I remember correctly, hearing the data. So we are on a pretty good trajectory at this point. So much so that if you look at the rate of influx of vaccine and project that forward, and you look at the rate of vaccination in and around at least Monroe County, we'll talk about the southern tier where we still have some work to do. In Monroe County, we should be able to reach 81% of all eligible patients with current eligibility by the end of May. So that would be pretty good. Now, obviously, as we go down in the southern tier, Steuben is making some strides, but still relatively lower. Allegheny is still the lagging county in the state. There's been a lot of focus and attention on that as of late, and supposedly there was a bit more vaccine that was shunted towards Jones and some of the Allegheny Health Department this last couple days. So hopefully that will help backfill some of the inequity that we're seeing by region. But on the whole, in the Finger Lakes region, I think the most vaccine we had received to date was 25,000 doses in a week. This week, we're set to receive 37,000 doses. And there's the promise and anticipation that that will likely continue to go up week over week now for a bit. So that's good news. As far as what that means for practices administering, still not very clear. I know there's been some ongoing discussion. Certainly J&J offers some stability. Pfizer has now applied to the FDA for approval to allow for refrigerator storage of their vaccine, which obviously would help increase the capacity or ability to distribute that to other administration sites. But as of yet, I have not heard that there's any immediate plans, as we've talked about before, for regular physician practices to begin vaccinating. We do, however, have approval to move forward with vaccinating inpatients, and hospitals are starting to get an influx of vaccine for that purpose. So specifically, anybody over the age of 65 who gets admitted to the hospital, the hope is that they will be able to vaccinate them all. If there is inadequate vaccine, then they will do a randomization process to try to capture as many of them as possible, with effort to focus on those who are going to areas of inequity. So inner city, those who are unable to come back for second doses, those who are coming from areas that aren't getting as vaccinated, obviously like Allegheny County folks who get hospitalized would potentially get preference. That is going to be Johnson & Johnson vaccines, specifically because of the anticipation that they may not be able to get them back for a second dose. So it's going to be J&J that's going to be administered in the hospital. They will continue to use Pfizer and Moderna in these other 2-dose clinics as they have been, and then we'll see where that goes. So that's kind of the state of the union right now. As we stay, we'll get into a little bit more specifics going forward. As I said before, the only 2 places that you may not want to be from at the moment are Texas and Mississippi. So both governors, in somewhat of a surprising turn of events, have released or removed the masking requirements in both states. So those are no longer in place. The federal masking requirement for any federal building would obviously stay in place. But the state masking requirements have been 100% reversed in Mississippi and Texas. And the Texas governor took the step of saying all businesses, all schools, everybody could go back to 100% capacity effective immediately. Now, that's bold. It doesn't meet with the guidelines of what the CDC and all of the public health officials are advising. Unfortunately, that coincides with Houston being the only place in the world right now that we know that all 8 variants of the virus have been isolated. So yesterday, as the governor made this decision, they isolated the 8th variant. So that's a unfortunate designation for them to have. So as I said, I don't know that that would be the most ideal place in the world. Mississippi has been one of the laggards as far as vaccinations administration. So even though I do not believe they've gone to the full 100% all businesses open, removing the masking parameters at the same time that you're still having trouble administering vaccine is not a recipe for success necessarily. So we're going to see how all this plays out. Obviously, we're going to be kind of living in the midst of it and getting kind of active samples. There's all kinds of discussion as to, you know, what compelling the federal government can do of the states. The answer is very little, as far as I can tell. But you know, we'll see where this goes. But on the whole, we are, as you'll see from the data here in just a second, we are definitely heading in a better direction at the moment, and seeing hospitalizations, mortality, all of that, if not plateau, then definitely start to improve. Right on cue. So as you can see, the number of cases in the last 24 hours, this is the first time we've dropped below 60,000 in quite some time. The percent positive continues to decelerate. The mortality rate is interesting. There was a 2% increase in the last 3 days compared to the prior. So there's some concern as to whether that could mean a resurgence or a possible little blip effect, if nothing else, of the variants. So we'll see where that takes us. Certainly in New York, you know, we're largely continuing to trend in a better direction overall. Certainly seeing hospitalization go down. And then Monroe County and really the entire Finger Lakes areas will see a bit from the data that our Tri-County friends send us. Really every county is seeing a deceleration of case rates at this moment. There's still a little bit, if you look at Jones Hospital in particular, their percent occupancy of COVID remains at about 30%, and their occupancy overall remains at a relative high rate compared to their norm. So they're a bit of an outlier at the moment. But again, the vaccine hasn't caught up there. So it does seem as vaccination starts to peak, COVID rates are dropping and hospitalization rates are dropping pretty precipitously. So, we'll see what that means overall, especially if Allegheny starts to catch up and Jones Hospital starts to see the same exodus that we've seen in some of the other hospitals. That would be good. I don't know if there's a lot else to point out here. If you look at the graphics, we're now under that 2% rate in the Finger Lakes region as far as percent positive tests. That's where the rate of likelihood of community acquired transmission really starts to become statistically less likely. So that was the point that we'd always kind of searched for before. Above 2%, there's some risk of transmission. Once you get above 5%, there's a relatively high index of community spread and transmission. So now we're at 1.7% currently, which is obviously good news. And you can see the statistics are looking pretty good, really across the board. We're definitely starting to see some of those plateauing effects of mortality curves now as well. Also, the last graphic really just shows the number of new cases decelerating, and then this really shows the regional data. Wyoming County, a blip again, but they're a little bit more delayed in their reporting. So updated data is harder to come by from there. But everyone else really is showing a downward progression at this point, which is definitely good news. So testing, not that it really matters anymore because we're not seeing the volume of demand that we were previously. Testing is at an all-time high as far as availability, but at a relative paucity as far as demand, which is good. This has been the first week that I have not gotten some word about pre-procedural COVID testing, about how some of our practices are not sending orders. So thank you for that. You have saved me an inbox joy that I look forward to every week. So that's going well. I don't know if it's just our demand for pre-procedure testing is going down. The data would suggest not. But it seems like the testing as a whole is working very smoothly at this point, and capacity continues to ramp up, and reagent has not been as big an issue, although now there's a greater and greater desire to provide more rapid identification and return of testing. So, whereas before 18 to 24 hours was kind of our goal if we could ever achieve it, and we were dealing with days, now we're trying to focus as much attention as possible on getting those modalities that can return a test within an hour, just to try to expedite even faster, which is great. So testing is great. From vaccine administration issue, we continue with the same rules. Johnson & Johnson, as you know, is only approved for 18 and older. So continues at this point that Pfizer is still the only vaccine available for the 16 to 18 category. All three can be used in 18 and over. The Johnson & Johnson, the early administration, obviously I think some of these people were just happy to get a vaccine, but there's been an early report that the arm pain and the side effects were maybe less than what we saw with the first shots of Moderna and Pfizer, so that's certainly good news. And we'll see how this goes over the coming days as Johnson & Johnson starts to get administered much more broadly. The one thing I will point out for the Hawkeye Clinic at Kodak, if you have folks that live in those zip codes, that is the one clinic where there is still an excess capacity of vaccination appointments available. Certainly there's more vaccine hesitancy in those zip codes and populations in general, but it's worth, I could try to recite them for you, but there's actually quite a few. But certainly if you're talking about inner city, northern part of the city in Rochester, those folks could probably get an appointment within the next couple of days quite easily. Also, although those folks do have the ability to go to pharmacies, Department of Health, that has not been restricted at this point, as much as possible. Obviously, we want to create equity so that everybody can get vaccinated. But those folks have pretty ready access at the Hawkeye site. which should, if we could shunt everybody else to the DOH and state pod sites, we should have greater access for everybody to some extent. There is some discussion that the pharmacies are going to be increasing their vaccine availability as well. So we should see all boats floating a little higher in general. But for those who live in those high risk inequity zip codes, for the moment at least, if they want it, they should be able to get it very rapidly for right now. I have had a couple of folks who reached out to me specifically about the state pod sites, that there have been some patients who were turned away or who were told that they needed to provide proof of chronic disease before they could get vaccination. That seems to be kind of somebody going rogue and not necessarily doing what they're supposed to do. So we continue to get that. Every time we feed it back up to the task force, that goes to Vinny Esposito, and it seems to kind of get rectified, as Vinny is the one who oversees that, at least locally at the Dome Arena. So feed that to us, but we continue to be told that that is not a requirement, that they can self-attest and get vaccine at all the Department of Health and state pod sites in this region at minimum. So let me know if that continues to be a problem, but my understanding is if it comes up, they try to reach out and retrain that person as quickly as possible. Look at that.
So Chad, this is from a Department of Health website, the Onondaga County one. So this isn't for a state-run site, this is for a county-run site. And that county-run site is saying you need proof of your comorbidity or underlying condition. So apparently it's still a patchwork across the state.
Yeah, so Onondaga Steuben has been the same, although it sounds like Steuben may be joining the fray a little bit. Steuben has been in the southern tier task force region, and Onondaga, I can't remember what they call their task force now. So Central, there you go, exactly. I was going to say it's not mid, something like mid, but central. So the Finger Lakes task force for those 9 county areas have all agreed that they do not require any certification, that patient attestation is acceptable. Steuben being in the southern tier task force and Onondaga being in the central have yet not been, they don't have to dance by the same rules because they have their own agreements, but it does make a difference if patients are going to the fairgrounds, obviously, to get their vaccine, that they may need it. So just know if they go to the 9 county area that's encompassed by the Finger Lakes task force, that agreement holds. We have had several folks reach out, about the Steuben County being outside of the Finger Lakes task force and the availability of an advertisement of vaccination sites not being quite as robust. And that is true, although Steuben County, my understanding is making a big step to try to improve that access, especially in the last week. Onondaga and the fairgrounds site, from all I hear, runs like a top. It's quite efficient, but they are not necessarily beholden to the Finger Lakes task force rules at this moment. So yes, I think if you know someone is going out of the immediate area to get their vaccine, it's probably safer to get them some generic statement. I will say, at least when we had the conversation with the state folks, there had been some issue of, if we put too much PHI on the letter, that's also bad, because the people who are volunteering at these sites shouldn't necessarily have access to the patient's medical history per se. So there had been agreement that we could just say, from a physician, this patient meets the current New York State criteria for chronic disease to receive COVID vaccination, and that we would not have to be any more specific than that. So I know in Epic, we've made some dot phrases that we could use. There's been some discussion about trying to socialize that as much as possible, but obviously just within AHP, there's 10 different EMRs. So having everybody share a dot phrase is not realistic, but that wording that I just regurgitated is acceptable from a state standpoint. And that letter can just be sent to folks through their EMR, My Chart Encounter, whatever engagement portal that they use. And I see in there from Christine Walther, they can screenshot their medical diagnoses. That is true. They can download anything that shows their past medical history although they should not be required to have to disclose their entire medical history to do that. A general statement from any medical provider would suffice, but obviously that means that we have to generate those letters, which I realize is a pain in the butt at the moment. So I think that's all I have to say about vaccine. For PPE distribution. So I had made a lot of promises. I realized last week about how it was going to be the largest PPE distribution ever known to man. And then a truck driver didn't show. They had the wrong size truck. They couldn't get the pallet jack into the door. So you don't even want to believe how much trouble it is to get boxes 4 blocks up the road and inside of a building. Even today, special thanks to Jim Wright and Kevin Kelly from AHP for all of their efforts. The comedy that this was of getting a pallet jack into the building, going through a service elevator because the door was not wide enough, and then parking it in the atrium and hand trucking it into a room. It only sounds ridiculous because it's true. So today we gave you what we had on hand. For the next distribution, we actually have all of the stuff that we have ordered. For once, it is finally on site. So the next distribution will be the large scale distribution where we will just be handing you big cartons of stuff. So that is a promise, not a lie this time, because we actually have it.
And bring vans, trucks, SUVs. Try to avoid sedans.
A friend, a back brace, something. so that will be the end coup de grace of the PPE.
Strap on your truss.
That's right. So just so you know, if you exactly wheelbarrows, whatever it takes, Sherpa, goats, I don't care. So the PPE distribution. So our anticipation is once we get this last big bolus out. Number one, the hope is that will cover you for quite some time. But number two, we are still trying to get folks transitioned over to this new group purchasing organization arrangement. Some have already done so, some still have not. Obviously, this is not a requirement, but I would be willing to wager that there's almost no practice under any other group purchasing arrangement that will have the discount potential that you will get through this arrangement. So there's a little bit of a pain in the butt. We're trying to work through the customer service components. We've had every promise in the world that the Medline team will do everything they can to make it as seamless as possible to transition your ordering process over. I know some folks, it's not been exactly perfect, but we're trying to work out those kinks. But my hope is that this will be at least more advantageous than what you've got, and that there'll be more opportunities for other discounts and purchasing abilities than you even have through the current group purchasing arrangements. So that's the plan. And then, as we said before, if the whole world crashes down and everything that we thought was true is suddenly not, and there's allocation issues, we always can turn the faucet back on again. But for now, it's been almost a year, almost exactly a year now. So once we get to March 12th, it will have been exactly a year since we were raiding Lowe's and Home Depots across upstate New York. So as much fun and excitement as this has been, we've heard loud and clear that most folks now have ready access. So hopefully we'll be able to get it to you cheaper than what you were able to before. But our shipping and receiving days, as much fun as they have been, we are more than happy to retire those if at all possible. So that will be coming. It's Groundhog Day, you got that right. I think that's the last big thing for me. LJ, do you have anything you want to add?
Oh, yes, I do. You're going to be so excited to hear this one. Talk about Groundhog Day. I want to make sure that the pediatricians are aware that the AHP has released revised guidance on return to play. So their COVID-19 guidance has changed as of March 1st. It really has just changed for the better. So I think with more cases of COVID in youth and in children, they're able to liberalize the guidance a little bit more. We will be revamping slightly the algorithm, the FAQs, and we'll send that out in a distribution across all practices and across the network, but to capture it in briefly so that people know patients are still needing to be seen by their PCP once they have come out of isolation and they're fever free for 24 hours. So nothing changes in terms of your initial role. They have highlighted in this guidance, I think, better qualified what constitutes moderate versus mild symptoms. So they're making a distinction between length of time for fever. So for mild symptoms, it's less than 4 days. For moderate, it's greater than or equal to 4 days. But then for systemic symptoms, they're extending that to be less than 1 week of myalgias, the significant systemic symptoms for the mild category, and greater than or equal to 1 week for the moderate. So it makes more sense. I think that was a place where a lot of the providers were running up against, what is this really? Is it moderate? Is it mild? And the big thing, which I'm sure our cardiology colleagues are doing backflips over, is they have now stated that patients who fall into the moderate category do not require automatic referral to a cardiologist. Along with the PCP assessment, they require an EKG. Obviously, if someone's assessment is positive or their EKG is concerning, they require a referral. So it just feels like a balance of common sense, and still is all expert opinion, right? They're still looking at cases. The age issue about whether or not you have to do a graduated return to play remains the same for kids greater than or at 12 or older. Those kids should have at least a minimum of 7-day graduated return to play. We're still asking the schools to engage and to monitor the athletes. But all the other younger kids, they can go back. If you clear them, they can go back into things. The other couple of pieces that the guidance highlights, which I think is really good, it specifically calls out the fact that a second visit to a primary care provider is not required. Once you have cleared them once, they can do their return to play and they get to go back. So a second visit not required. And the last thing is they made kind of a general statement, which we'll try to highlight in the information that we send out, which really is saying that all individuals, parents and caregivers and patients should be educated to the fact that they should be watching for and reach out to a healthcare provider if a patient does develop new symptoms of chest pain, new onset palpitations, or new onset syncope, or extreme fatigue or shortness of breath that is disproportionate to an upper respiratory infection. So that was the LJ Shipley summary of what they put into that new guidance. But I feel like they really read what we sent to them and what we've been saying. And it's not just our community, obviously, many other primary care providers and cardiologists have been reaching out to ask for something that's a little more doable. So I'm seeing in the chat that several school districts telling patients that they do not need to see us after COVID diagnosis. We are really pushing hard on the schools now with this, and with the AHP finally putting something in writing that supports what we modified a few weeks ago based on our conversation with them. We're really going to go to the state to try to get some support for this, because there have been lawyers advising the schools not to participate, and it's kind of a mixed bag. Some districts have been saying exactly what Danielle has noted in the chat. Others are completely on board and they're doing their part. I think we just have to keep going with what we feel is best practice. And again, this is best practice. This isn't a mandate, at least at this point, but hopefully we'll get a little bit more consistency. I think this is very reasonable. And when you think about the increased number of cases of Miss C that we talked about last week, which have happened because we've seen more cases in kids, this is a really good thing, I think, for kids to have an assessment after COVID, for parents and guardians to be educated so they can be watching these kids, not just in the 7 days post, their infection period or post-release from isolation, but in the weeks following, so that hopefully those kids show up for care if they're developing new symptoms. So I think that is everything that I had in that space. The only other question I wanted to ask, and Liz just teed it up perfectly. Thank you, Elizabeth Murray. I'm just curious, and we can talk, you can just put in the chat or you can email. what the pediatricians and family physicians are thinking. Are they feeling like there's enough information that's going out from Gulf Center Children's to the parents of 16 and 17-year-olds and the 18-year-olds who qualify for vaccine at this point because of complex medical conditions? I know that a letter went out from Tim and Pat and I last week to everyone. The email and letters are going out to the individual patients, but Liz has offered to do some media outreach if it would be helpful to get the word out, because that is a new category of patient, and a lot of the communication that's coming from the vaccine hubs has been very focused on adults. So we're trying to lift the information about these patients. So Toby's saying she doesn't know where to refer hers to get it. So Toby, we can think that through with you. I don't know that off the top of my head, but there should be a state site that would have the Pfizer vaccine that you can do. I mean, certainly they could come up to Rochester. I don't know if there's something that's closer. I would think there must be something closer to you, and I just don't know off the top of my head. If anybody else wants to message in the chat, if you feel like some additional media outreach that Elizabeth could do. She has a nice little spot tomorrow morning, right? Where she could do a little bit of education for families. So you're all quiet out there. Yeses or nos, thumbs up. Do it. Okay, awesome. Thank you, Katie Edwards. Oh yeah. Okay, now you're all messaging it.
Yeah, because my concern is that, I don't want you guys to be onslaughted with questions if it's not helpful, but if your offices are ready to take the question from the parents, and since they know you best, getting the information from your primary care doctor seems best. But since it's only the Pfizer, since in Monroe County, there's only 2 locations where people can go, I just thought maybe it would be helpful to put that out there. But it's only like 3,000 kids, so it's not a huge number either. So that's what I was trying to balance. Is it going to generate more problems for everybody? Because then parents are going to think like, oh, I wonder if my kid qualifies, and then are they going to call you more? So that's what I was just trying to balance. Because I could always talk about Poison Prevention Month too. We got plenty of stuff there to talk about.
Liz, I think the one thing is, if you did mention something, I wonder if referring parents to the GCH site and making sure that the list of qualifying conditions is up on the site, that would save the PCPs a lot of calls from people. Those people are like, oh, maybe I qualify. If we did it that way, to say you can check on the list in terms of qualifying conditions, I think that could be helpful. But I do think that it is really important to get the word out, particularly as Chad was pointing out, to our families who are in the zip codes that are being prioritized right now. I mean, those kids with complex conditions who also have significant social determinants risk, like we would really like to get those kids into those spots, the ones who qualify.
Yeah, I think Tim Stevens was saying yesterday for the AC6 patients, the open rate for those emails that went out was about 20%. For the subspecialty patients, it's about 40%. So some people are getting it, but
and some practice have been doing direct outreach. So I think that particularly just to highlight, I think it's great, Liz. If you could do that, Elizabeth, that would be awesome. And it looks like everybody is saying the same thing. And Dave Topa's adding that 16-year-old kids who work in restaurants and grocery stores and health facilities should also qualify. And I'm thinking about that because I hadn't really thought about that. Chad, is that true, right?
Yeah, I mean, they would fall under that 1B qualification. So yeah, they would fit.
Good point.
We've even had a few folks who are, like runners or MAs who are whatever working in the summers and practices who were able to get vaccinated because of primary health exposure. So yeah, they should qualify.
Awesome. Great point, Dave Topa. Thank you.
Yep.
All right.
The other thing I should mention that actually Laverne Slew Sharp reminded me of, there has been some questions. There was a flurry maybe a couple weeks ago, and I'm guessing it was due or follow up to the 60 Minutes episode that aired about the COVID long haulers syndrome. And do we in the greater Rochester community have any COVID long haulers clinic, specifically as the U of R, offering anything for these folks who continue to have symptoms long after the resolution of the acute viral phase? So 2 answers to that question. There is within U of R pulmonology a post ICU COVID clinic that they're following those patients. They have a lot of issues, probably the sickest of the sick, as far as a general long haulers clinic. So there are folks who get mild, moderate COVID who just never improve. Their symptoms just seem to kind of lag, or they have kind of relapsing, remitting kind of syndromes of it. we're just starting to learn a lot more about that. There is nobody in the community at this moment, Rochester Regional or U of R, who has a long hauler clinic at this moment. But we did start having some of that conversation just because there has been a bit of interest, whether or not it was because of the 60-minute show, I really don't know. Or we just seeing more of those people now after the spike. But at this moment, there is none, but we'll definitely keep you informed if that comes to be. So thanks for those who have reached out, but unfortunately, no, it doesn't exist at this moment.
Chad, I have something for the group if we have a little time.
Fire away.
I wanted to show folks a little something to advise people if they're getting frustrated at the state website. Because this happened to me, I was able to schedule my 17-year-old restaurant worker. And I went to the Dome, this is the Am I Eligible website, and it says here, Dome Arena, no appointments available currently. But I said, what the heck? I'm going to click the link anyway. And sure, now it says no appointments available. 5 minutes ago, there were 6 appointments. Okay, so don't take the no appointments available as Bible truth, click through anyway and see what's there. Because I did, and it paid off. So just a pro tip from me to you.
Renee, this is Daryl. That was actually advice in the newspaper this past weekend. In the DNC, the exact same thing. Like, just ignore it because the website can't keep, it's too fluid and it just is too clunky to keep up with it. So just ignore that whole thing.
Definitely.
And the other thing that I would—
Here I am thinking I'm an innovator. No.
Well, you are,
Oh,
Renee. You are.
The other thing I would point out is that up until this point, the state would find out by Friday how much Moderna and Pfizer they were getting allocated from the federal government. J&J, it was Monday. So it was out of sequence, and we still don't know at this moment whether the delivery sequencing of J&J will be different than it is for Moderna and Pfizer. The reason I bring that up is because these websites for appointments update as vaccine is received. So the mandate, at least in the state, has been you cannot schedule an appointment until you have vaccine that's in hand, essentially, because we all had the cluster when the snow hit and we couldn't get stuff shipped and everything else. So now it is, you can't schedule the appointments until you have confirmed that you have it inbound and have receipt. So if they get a shipment of J&J tomorrow, they may open more vaccination appointments because they've got more vaccine to give. So it probably will be worthwhile to check and, as Renee said, click past that first screen because it will be updating much more frequently potentially than it has in the past. There's also, as if a site, for instance, there was one site that got 1,000 doses of vaccine. They've been trying to get, hadn't got. They got 1,000 doses in Allegheny County. And they said, there's no way in hell we can give 1,000 doses in the next week. So they reallocated that. And so some of the other sites all of a sudden got vaccine from that 1,000 distribution that they had not intended, but that created more appointments. So the pro tip actually is a smart one because the flow of vaccine happens in mysterious ways in some cases. So there's no schedule to it anymore.
Oh, thank you. Oh, wise one. That's a good way.
Yeah, now everybody's saying reallocate to me. Unfortunately, I have no power whatsoever. I just know that they do reallocate. I do not get to vote on the reallocation, unfortunately. So anything else, Renee, that you have? LJ, anything else from you?
PCP Advisory Committee, Pediatrics, for those people who are representing their practices is tonight, and we have shortened the meeting to 1 hour. But it will be a good meeting, lots of information and opportunity for you to all give feedback. So please be there at 7 p.m. by Zoom. Thanks.
Perfect. All right. So I think we've run through the chat room. So unless anybody has questions, we can call it a day. I don't see any magically unmuted. So that'll be the end. Thanks, guys. We'll see you next week. Have a lovely. Take care.